What's up, you guys? I'm Dr. Nick. If you are diabetic, this is a video that you don't want to miss because I'll give you some tips on bad things that can happen and what you want to do to avoid having this happen to your feet. So this patient had their furnace go out and their feet were cold, so they put on a couple pair of socks, thought that would take care of the problem, and they are suffering from peripheral neuropathy. So if you're diabetic and your sugars are not in good control, you can develop a condition known as peripheral neuropathy. And peripheral neuropathy is a situation where you lose sensation to your feet as a result of the high blood sugar levels. So this patient could not adequately feel their feet. And one of the sensory mechanisms in our feet is temperature. So when these nerves aren't working adequately from peripheral neuropathy, you will not be able to feel or sense temperature changes. So one of the first problems that they did was put on 2 pairs of socks, and by doing that, the thought was to improve the warmth, obviously. But what happens is if you can't feel adequately and those socks bunch up, or you try to force your foot into a shoe and it doesn't fit adequately, that sock can rub and create a blister. So that's what the patient thought had happened. But in all actuality, remember, they were cold, they had a fireplace going, so the thought was to put their feet near the fire to keep them warm. The problem is you can't sense temperature with peripheral neuropathy. So they were close enough to the fire that the fire created second-degree burns on their feet as a result of the increased temperature. So if you saw the pictures of this is actually only 1 foot, and the concern from this patient was, why is it only on 1 foot? Well, most likely the reason is that their feet were crossed and 1 foot ended up closer to the fire, and after falling asleep, that temperature just increased enough to cause these burns to form. So if you're watching right now and you're wondering, well, aren't you supposed to just drain the blisters? Why are you removing the skin? So let's talk about that. This is I don't want to say controversial, but some people will say just break the blister or puncture it to reduce the fluid. Well, the problem that I have with that is if you do that, one, the fluid can fill back up into that area. So if the fluid fills back up, you're in the same position you started with. You have fluid-filled blisters. So what's wrong with the fluid-filled blister if it's sterile and you're not putting yourself at risk for infection? Well, that's true if you're the patient doing this. But as a physician, our job is to improve the overall outcome of the situation that's occurring. And one of the problems by leaving that pressure, or that blister I should say, is that pressure starts to increase. And with increase in pressure, you're going to start developing tissue necrosis from the pressure of the blister and the underlying skin. Now, blisters like this possibly wouldn't create enough pressure to do that, although any increased pressure with poor blood flow, which can be present with diabetic patients, can lead to tissue necrosis. And the other reason you want to get rid of these blisters is if you do it in a sterile environment, which is in our office. If we're doing it sterilely and painting the skin in the area with betadine and putting antimicrobial bandages and dressings and ointments on, you're reducing the risk for infection. So I like to do it in a controlled environment and then have the patient treat this as an open wound to prevent infection. And in this particular situation, we did put the patient on an antibiotic, as well as prescribe something called Silvadene cream, which is an antibiotic cream that we generally will use in burns. And they will also have a non-adherent gauze being applied over the wounds. So the goal that we're doing here is to remove all of these blisters, to reduce any increased pressure, and also, as I had said, to do it in a sterile environment. You can see there were multiple areas, and these are actually second-degree burns. We're going into the dermal layer. So what I'm cutting away now is the epidermis, and that's all serous fluid under it. And you're going to see when we encounter the one on the great toe, this has some color change to it, and the concern was that this one could be infected. So we were looking for a purulent fluid, which is nothing more than the medical term for pus. So if we see purulent fluid, then we're concerned. And I did culture these. You'll see at the end of the video, we do swab them to make sure that there is no underlying infection in this area. So you can see here, there looked like a pocket was starting to form, and there is some blood coming from there. And the worry was that there could have potentially been a bacterial infection starting. So we'll use culture swabs to swab that area to make sure that there's no underlying infection. And sometimes these extend into the inner spaces, as you can see here, and we're doing our best to make sure we remove all of that. So these are the culture swabs. We're swabbing the entire area. We will get that area by the big toe where there could potentially have been a bacteria. Those were aerobic, and then we do an anaerobic because there's two types of bacteria, aerobic bacteria and anaerobic bacteria. And we want to make sure we culture for both of those. And you just want to make sure you remove all that loose skin, because as the patient's cleansing and cleaning their foot, you can have areas of skin that are still attached. And if they tear it, they'll create a new open area. So we want to make sure we get all of that wiped away. So thanks for watching this video. If you have any questions or comments, please drop them in the comments section below. You can click on some of these other videos that are present here. And if you have anything that you want to see or questions about any types of problems we see in the office or surgeries that I perform, please drop it in the comments section below. Thanks again for watching, and please make sure to like and subscribe.